Messi, Ronaldo, Neymar. These are the greatest football players who ever lived. But even the greatest are not untouchable. Some football injuries are so brutal, so painful, that just watching them makes you flinch. Today, we are reacting to the most brutal football injuries ever recorded, and I'll explain exactly what is happening inside the body and what doctors do to fix it. Football is one of the most physically demanding sports in the world. Players run up to 13 kilometers in a single match. They jump, tackle, sprint, and collide at full speed. And sometimes, the body simply cannot take it. Let's count down the most brutal football injuries ever caught on camera. Oh, did you see that? His leg just snapped. That right there is what doctors call a Tib-Fib fracture. Now let me explain what that means. In your lower leg, you have two bones, the tibia, the big one, and the fibula, the thinner one on the side. In this injury, both of those bones broke completely. At the same time, the force from that tackle was so powerful that neither bone could survive it. Now here's something that many people don't think about. When a fracture like this happens, the biggest immediate danger is not the broken bone itself. It's whether the bone has pierced through the skin, what doctors call an open fracture. Because if it does, the risk of infection becomes life-threatening. The first treatment on the field is simple. Keep the leg completely still. Do not move it. Do not try to straighten it. At the hospital, doctors will reduce the fracture, align the bones, and in most cases, insert a metal rod to hold them in place while the bone heals over the next few months. This player was sidelined for almost a year. Oh no. That knee is not supposed to move like that. What just happened there is an ACL rupture. Your ACL, the anterior cruciate ligament, is one of the most important stabilizing structures in your knee. It connects your thigh bone to your shin bone and stops your knee from collapsing sideways. When it tears, sometimes you can actually hear it. A loud pop. The player certainly heard it and felt it. Within minutes, the knee will swell massively with fluid and blood rushing into the joint. The pain is described as extreme, immediate, and deep. Treatment, surgery, almost always. A surgeon will take a graft, usually from another part of your own body, and rebuild the ligament. Recovery takes 9 to 12 months minimum. And even after that, many players say the knee never feels completely the same. Oh, that is the most terrifying sound in football. Two skulls colliding at full speed. This type of injury is called a depressed skull fracture. The outer layer of the skull, the parietal bone on the side of the head, cracks inward from the force of the impact. Now here is the part that most people do not know. Inside the skull, near that bone, runs an artery called the middle meningeal artery. If the fractured bone damages that artery, blood begins to pool inside the skull. This is called an epidural hematoma. And if it is not treated within hours, the pressure builds on the brain. This can cause brain herniation and death. This is not me exaggerating. This is basic emergency medicine. The player in this clip survived. He had emergency surgery, and when he returned to football months later, he wore a specially fitted protective headgear for the rest of his career. Oh no. Ankles are simply not designed to move like that. What happened here is an ankle dislocation combined with a fibular fracture. The fibula, the thinner bone running down the outside of your lower leg, snapped under the pressure, and the ankle joint itself dislocated laterally, meaning it moved completely out of its normal position. On the field, the most important thing is, do not try to relocate it yourself. Stabilize it, ice it, get the player to hospital immediately. At the hospital, doctors will give the patient conscious sedation, a combination of medications to relax and briefly sedate them, before carefully pushing the joint back into position. Then X-rays, then surgery if needed. He's out, completely out cold. When a player loses consciousness from a head collision like this, every second on the field counts. The immediate concern is: 1. Is the airway clear? 2. Is the player breathing? 3. Is there a pulse? The medical team's first action is to roll the player onto their side, what is called the recovery position. This prevents their own tongue from blocking the airway and prevents them from choking if they vomit. Now, some players appear to have seizure-like movements after a knockout. This looks terrifying, but in many cases it is not a true seizure. It is the brain briefly deprived of oxygen, causing what doctors call hypoxic jerking, the body's way of reacting to the sudden loss of blood flow to the brain. True full assessment of a head injury like this requires a CT scan of the brain at the hospital. Doctors will check for intracranial hemorrhage, bleeding inside the skull. If there is bleeding, emergency surgery. If not, rest, monitoring, and a gradual return to activity. The worst thing any player can do after a head injury like this is return to the field too quickly. Second impact syndrome, a second head injury before the first has healed, can be fatal. Football is a sport of passion, skill, and sacrifice. These players put their bodies on the line every single time they step onto that pitch. And now, you know what is really happening inside the body when you see one of these terrifying moments. If you want to see more breakdowns like this, comment below, which sport should we react to next? And if you learned something new today, hit that like button and subscribe so you never miss another video. Stay safe, and I'll see you in the next one.